People experience stigma when they feel a sense of rejection based on a personal characteristic, in this case, drug use. Stigma is the attitude and discrimination is the behavior, but discrimination can take many forms. Research shows us that stigma and discrimination lead to poor health outcomes. People avoiding care, dropping out of treatment, and only seeking treatment when very unwell. These videos are people who use drugs talking about positive and negative experiences of healthcare.
The whole time it's like I'm listening and feeling for that judgment or that remark of derision or whatever. And as soon as that comes, it's like, boom, I shut down.
I'm second guessing. Should I go in there? Should I be honest? Should I lie?
In that kind of situation, you're either going into it with this enormous amount of anxiety or you're going into it almost ready for the battle.
I've just kind of been known to flip the table and give up on trying to pursue a certain diagnosis or certain healthcare altogether because it just seems like too much work, and then kind of makes me ignore problems and then they pop up again.
Because I felt like maybe I shouldn't have told them I'm Aboriginal, maybe I shouldn't have told them I'm on an OTP program, and that turns me off going to a hospital, doctor.
We're in a position of power, and I think what we don't realise is what they're really seeking is a doctor that's got a listening ear, a doctor that's going to look at them as a whole person.
Stigma and discrimination adversely affects people. It affects their health generally. It affects their access to services. And I see the way it plays out and the internalised stigma, how people take these identities on and start to believe that it's who they are and how that affects them and how it affects the way they access care. And everybody, no matter where you come from, no matter what you look like, no matter what your name is, no matter what your background is, have a right to have really high quality care, and that stigma stops that happening.
Just changing the conversation from when they sit down in the room and you're pressed for time and you go, what's the matter with you today, or what have you come in for today? Instead, just changing that to what matters to you today.
Just don't judge.
I think the main thing would be for the staff to try to make that person feel comfortable and remember that they're a human being.
An open and equal communication style, so there's not the absence of the implied superiority on whatever level of clinician versus patient.
When you get a lot of judgment from outside people and then you speak to this person who's a health professional that understands you at a base level, it's really relieving, because it does take a lot of judgment away from yourself, because there is a professional out there that sees you for more than what you're experiencing, essentially, and sees you as just a person. If they're there to treat me for one thing and the other thing isn't directly involved, then I don't think it's necessarily their job to be commenting on it.
To be second guessing what you've got to say, to being shamed about when you get a question, I see you've had a previous hepatitis C infection, how did you get that? Were you sharing dirty needles? That's not what was said, but that's the insinuation. So it makes me think twice. It makes me be not so much dishonest, but not open.
Awkward. I feel like I'm dumb. I feel like they're deliberately doing it to make me feel dumb and awkward.
For me, coming from a cold community background, how people, they don't like to be judged. They rather end their life than be called names and people knowing about them, the community knowing about them. That's a stigma right now.
And so I think it's really important as a healthcare worker when you realise, oh goodness, that something I've said didn't gel for that person, to say, I'm terribly sorry, I'm just noticing that maybe that word I used or that phrase I used maybe had an impact that I didn't intend. I want to apologise for any impact it's had. Can we work on that? Can we understand that?
Having that feel of respect too, because us as drug users, we will respect a medical professional if they respect us and meet us in the middle.
A non-judgmental style of talking and interacting is hugely important because it means that people are given space to actually really talk about what's going on for them.
You can tell when someone's sort of not being open and honest and a part of the conversation, you know, when they're just sort of ticking off boxes on the sheet and trying to get you out of there.
The thought of having blood taken is just such an ordeal. And, you know, the doctor came to the bed and I said, don't use this one, don't use this one, try this one. No, I don't understand why, would not. And it was over an hour of trying various sites and even getting the scanning machine and here, none of it worked. Eventually, and got this doctor, this nurse, eventually tried this spot that I indicated because there was nowhere, got it the first time. And I was nearly in tears because of all the jabbing.
Doubt I would continue going to one if they were outwardly judgmental, or if like I just wouldn't go to a practice that said no benzos or something like that.
When you go in and you speak about yourself and you know what's happening and they will tell you otherwise at a face value level, like because they feel like they've got a better understanding of what's happening, like it's a very big instant turn away.
Firstly, it should be individualised. So we're talking about people who use drugs, but that doesn't mean that every person who uses drugs is the same person, okay? So we need to explore who that person is, where they're at, what they're hoping to get from care, and what their choices or decisions might be around substance use at this point and into the future, and respecting those decisions and choices, and hopefully working with that person regardless of their choices. Their person-centred care should be holistic, so looking at every aspect of a person's well-being, their physical well-being, their psychological well-being, issues around their social well-being and their spiritual well-being, if that's something that's important to that person. And
a person whom you don't yet know, rather than a label and all the stereotypes that come with that.
It's like there's a few times where I'm like, oh, nah, I'm a bit flustered, or I've got a doctor's appointment and that's nervous enough as it is. Oh, will they know that I've had a smoke this morning, or will they know this? And so then I would either cancel or, but in terms of, I found a GP that was just like, it's okay. It's okay. It's all right. Thank you for letting me know. And why are you here? Like, what is it I can do for you? And that's amazing.
She listened. Her feedback in the conversation didn't seem condescending. She didn't want to know why I used drugs in the first place. She asked about my general health. Give me a rigorous going over, like heart check, lung check, blood pressure, all the things the doctor should be doing when they're looking after your health care. And it was just there was no condescending tone in her voice.
The anaesthetist that I had as I went into pre-surgery, I was, as you need to be, I was very clear with him about being on methadone, and he was extremely understanding of that. He knew his position with that. He understood that I would require obviously higher doses of drugs to knock me out. He was accepting of the information I gave him. He was not judgmental. He took on board that information and made an informed choice and moved forward with it, rather than in other circumstances where you get that immediate brick wall. He understood what needed to be done and he went forward with that.
Like, it's an ability to listen to people and what they know about themselves and what they might need and want.
And when I started acting on that advice and I started getting better, that's when I knew that she was listening to me and I was listening to her.